All right. Thank you so much for joining us today, Brittany. I really appreciate it.
Thank you. I'm happy to be here.
Great. So, I'd like to talk a little bit about your journey and what led you to become a myofunctional therapist.
Yeah, absolutely. So I did the traditional braces in middle school and went through that process. And then I started to have a lot of jaw issues, a lot of clenching and grinding. And my oral behaviors undid that initial set of braces. So when I was in college, after going through a lot of jaw appliances and components of that sort, I needed braces again because my teeth were back to being crooked and my mouth was narrow, my
Mhm.
palate. And so we went through braces again. And then within 3 months, I undid them, undid the braces in regards to I was released. I was done. My teeth were straight. It was great. And then within 3 months, they went crooked again.
Wow.
And I didn't know why. I didn't know what was going on. I wore the retainer. I did everything, trying to be a good patient.
Mhm.
And that was when we first heard of myofunctional therapy. We, as in my parents and I. And so we went that route, and I found out I had a tongue thrust. It's where the tongue pushes forward or to the sides in a swallow or even while at rest. And that force was enough to move my teeth. Um,
Really?
it was, yeah.
Wow.
So, the teeth don't push back, but the
Mhm.
tongue has a lot of force. It's a
Right.
group of muscles. So after going through that, I learned, of course, about the tongue thrust, but my eyes were open because we were going into this avenue already with about 11 recommendations for double jaw surgery,
Oh,
just for structural purposes. It wasn't going to be helping my jaw issues. It was just for more aesthetics as driven by the doctors, but that wasn't our goal. So
okay.
Myo came along, and I loved the natural side of it. I loved how it worked with your body and acknowledge where one is starting, but then learning what are better ways, what are better tools for the mouth, for the muscles. And then I learned about breathing. And I was an open mouth breather and didn't know it. That's just what I was.
Mhm.
And I had tonsils and adenoids removed young, very young, but I still breathe through the mouth. And learning how that impacted me and was impacting me just changed my view on what I wanted to do career wise. I was looking for something in the health realm. And so personally experiencing how it impacted me and my health and just my confidence, my smile, um, I just wanted to go further and learn more about it because I was just
Wow.
fascinated and was wondering, why isn't this well known? Like, why isn't
Yeah.
this more known? Instead of, I always say, you hear about myofunctional therapy when you need it, but I
Mhm.
want that to
Right.
change. Like, I want it to be before someone needs it, we can do preventative. So it
Right.
was a personal journey, but one that I think, professionally it helps me all the more because I've been where people are on the other side of my table.
Absolutely. Absolutely. And when you were talking about jaw surgery, I just kind of want to go back and revisit that just for a moment because there are times, yes, that is the only option. I get that.
Yes.
But it was kind of the way you said it that really resonated with me. So you were being advised to do that more from just cosmetic
Yes.
versus, when people are looking at it from, okay, wow, you have a retruded jaw, let's bring it forward. So, as a parent, how would you know the difference? How did your parents know the difference?
It, and I agree with you. Time and place, it is definitely needed at times. For for us, how we were being advised for it, it wasn't for the root of the issue. It wasn't even for the issue. It was just like, wow, you're really narrow palate.
Mhm.
Your jaw is retrognathic, pushed back. Um, and so those are good points. And we went into Maya with the mindset of, okay, let's try this first,
Okay.
because it was such a big leap. And due to other layers I had, it was going to be really risky. And so we wanted to be fully certain. And some people do go through Myo and then they still need jaw surgery. But Myo was a good let's narrow it down. Let's really learn deeper of what's going on orally. And then after we've done that, let's see what is needed for jaw surgery. And for me, it wasn't no longer needed or recommended.
Wow. So the myo was enough to help with the retreating jaw in your case?
Yes.
Wow.
Yeah. So it's
That's
fascinating.
amazing.
My jaw was back, but really it's because of my tongue.
Mm,
And, the tongue, it has a resting place. And for most people, prior to myo, it's low. It's on the bottom of the mouth or kind of hovering or pushing
mhm.
forward on teeth. And especially at night, that has the potential for the tongue and the jaw to slide back. But part of the myo goal, pretty much for everyone, is to get the tongue up on the palate. And when you do that, the jaw automatically comes forward. So
Mm,
for me personally, again, everyone's so different. I was
right.
able to learn a proper tongue placement, which then rippled into the jaw alignment, which then helped my jaw joint, the integrity of it, and my clenching. And for me, those were just the missing puzzle pieces. It wasn't something that we needed to change structurally. It was more behaviorally.
Right. And how old were you the second time when when the braces didn't work and you went into myo?
I was 20.
Wow.
Yeah. So I was that cool kid in college with braces
Yeah.
and the cool appliances
Right.
and not what I planned. So it was neat to go through it at that age of not just thinking, okay, it's just traditional braces, but being more of an adult and thinking, okay, how is this going to help me further? And I just
Mhm.
had, yeah, I think a deeper appreciation for it, of course, leading to the
Oh,
profession. Um,
absolutely.
yeah, but
Right.
it was 20. Initial braces were 13, was 13. And then from 13 to 20, I had about 20 jaw appliances. So we tried everything.
Hmm. Until you
Yeah.
got to myo. And so on your website, which I will put a link to in our show notes, the joyfulbreathingcolorado.com, you define breathing education. So for our listeners, if you would please just explain what that is and what's the goal behind that concept.
Absolutely. So breathing education, it's really with the concepts that we can breathe, but is it optimal? And are we breathing
Mm,
what is correctly? Um, and kind of the textbook correct way of breathing is through the nose, driven by the diaphragm in a relaxed manner.
mhm.
But that isn't always natural. It isn't always doable. And so we really like to explore, okay, where is the breath currently? Is it coming through the mouth? Is it really shallow in the chest? Is it fast? And we even dive deeper. Okay, what are the beliefs behind the breath? And a great example is if there's someone who has asthma and has had a good chunk of their life with asthma,
Mhm.
and it, like my mom, for example, she does have asthma and she has had asthma attacks in the past. And I've been working with her, but she discovered the belief that no, I got to breathe through my mouth to get the next breath that's safer. It's safer for me. So
Mhm.
there's beliefs that get established through experiences.
Right.
That's one example. There could be trauma, there could be injuries, there could be illnesses where maybe a certain way of breathing had to happen and then the
Mhm.
illness cleared, but that breathing habit stayed.
Okay.
So we want to learn what are the current habits, and then also then move forward of, okay, is that benefiting you? Is that bringing you wellness in the sense of your body and your mind, emotions, the spiritual wellness, just however far deep someone does want to explore that. And then we try to find just what are little changes we can make, and this is by the person's choice, to just make the breath even more beneficial and just more optimal to them, to their goals, to their future wellness. And sometimes it is just a matter of switching from mouth to nose. But we recognize there are layers, and it's kind of getting like a personal master's in your own breathing. There's a lot that can be explored. And so it is with the goal of how can we just support the body with the best breath that one can get. And
So
it's
you're talking
individual.
not just, how you're sitting or breathing through your diaphragm, but based on these examples, I mean, you're even teaching people, this is, I guess, where psychologically it comes in. You take a flight of stairs, and when you're gasping, don't go open your mouth and do this. You teach them ways to calm themselves to where they can maybe trust their breathing. Is that kind of where you're
Yes.
going? So, oh, wow.
Absolutely. It's really being aware of the breath and realizing that sometimes in life, that's all we can control is the breath. And the breath is so powerful. And are we using it against ourselves, or are we using it as a tool? And we always think about what someone has going on, because how one person breathes will not benefit someone else. So it's very individually based. And just, going upstairs when you have to make that tough phone call, how are you going to breathe to better assist you through that? When you do have to go talk to your boss, public speaking, just a couple of weeks ago, I spoke in front of about 200 people. And of course I was nervous, and I had the choice. How am I going to use my breath? Even though I was talking about breathing, I could have let it run away from me, and kind of impact my nerves and confidence and self-esteem. But knowing the tools that I have in my personal toolbox, it's really just learning those little extra items to grab in those situations, in the life layers we have, to just really give ourselves TLC and power within the breath.
Wow. So on your website, you also talk about a connection between breathing and oral facial myology, which I guess is totally different, separate component here. So maybe you could talk a little bit about that and talk about how myofunctional therapy works specifically with
my dog.
That's okay. Specifically with a child who's diagnosed with an airway issue.
Yeah. So real quick, I'm sorry. The
That's
doorbell
okay.
just rang and the dog.
Oh, that's okay.
So myofunctional therapy and oral facial myology are the same, pretty much.
Okay. Okay.
Myofunctional therapy is now more the common term.
Oh,
I was
okay.
trained with oral facial myology, so sometimes I have that written elsewhere. How they interrelate with breathing, kind of generally, if you're breathing through the mouth, myo-wise, we will really look at, okay, do you have the lip strength to bring your lips together to breathe through the nose? We really work on lips as well. And is the tongue able to go up in the palate to bring the mouth together? So we look at the muscular abilities in breathing and how it is happening. Mainly when someone wants to breathe through their nose, they just can't bring their lips together and keep them together. So it's as simple as that. But sometimes people will have issues breathing through the nose because the tongue, even though the mouth is closed, the tongue is inching towards the airway in the back, or the tongue isn't toned enough. It doesn't have enough strength to be forward, or it's just kind of bigger than what we want. So it's kind of chicken or the egg, really. It's really hard to say, because you breathe this way, this is why your mouth muscles are this way, or vice versa. So it's a matter of really, like with the myofunctional side, looking at structure of the mouth, airway, the palate. If the roof of the mouth is very narrow, that tongue is not gonna want to go up, and then it's just going to stay low or back in the throat. So we look at those components, and then how someone, because of those factors, are choosing to breathe. And if, it is a matter of, is it just a matter of breathing, or are you breathing this way because of the structure of the mouth? So I never separate them. It's never like sign up for breathing or just sign up for myo, because I believe you can't separate them.
Right, they go together. Yeah.
Yeah, whether you're breathing in through your nose or mouth, air is going by your mouth. You know, how
Right.
you look
It's
at
only one
it
way in.
anatomically, yeah, down,
Mhm.
yeah, down to the lungs. So it's, yeah, very interwoven. Um, and it's, yeah, just really looking at all angles, really trying to see what is the full picture, as much of the picture as we can see,
Mhm.
structurally, muscularly, and functionally,
And then,
behavioral.
so I mean, obviously, we're looking at children's Airway First. We're focused mostly on children, but myofunctional therapy is not just for kids, correct? I mean, that can benefit anyone,
Yes, all ages. Um,
no age limit. So anyone.
no, no age limit. Yeah, the youngest I've seen is 6 days old. And
Oh,
then, yeah, and then all the way on up. So,
okay. And then I've always wanted to ask this. So, because I'm sure like our listeners, when I'm talking to people, they always talk about putting the tongue in the roof of the mouth and where it's supposed to touch, and it's supposed to rest against the roof. Just for clarification, because I have tried this repeatedly. Are you saying that literally it's flat? Like the whole tongue is flat up there, or are we talking about just the front of the tongue is flat on the mouth?
we want, great question, by the way, we want as much of the tongue to be up as possible in a comfortable, relaxed manner.
Okay.
And that is tricky. Like
Yeah.
you said, you tried it.
Hmm.
That's really where tongue ties come into play. We look, okay, is there a tie underneath the tongue that's just keeping it down? Does someone have the endurance to keep the tongue up there? Do they have coordination, the strength? So it really isn't as simple as, okay, put your tongue up there. Ta-da,
Right. Yeah,
Uh,
right.
it's like the pillows that say just breathe. Okay.
Yeah,
Not that
exactly.
simple.
Right.
but yeah, so ideally we want as much contact with the tongue to the roof, because it does stimulate the release of serotonin, our feel good chemical, centering chemical. It also has connections to the vagus nerve, which from there does help our breathing, with nerve innervation down to the lungs and just other components head to toe. But then also, as much of the tongue as we can get up, that does help clear the airway. But that does take time. If someone
Hmm.
does have, willpower will not override if there's a muscular or structural issue.
Right. Which totally makes sense. What could myofunctional therapy actually look like for a child with an airway issue? And I mean, I obviously we know your story now, but what kind of outcomes should parents expect?
Yeah. So if there is an airway issue of any sort, myo is through the form of exercises and
Hmm.
games, fun games. But it is to, for the realm that we are able to work on, how can we get that tongue, as I mentioned, up in the palate, toned up. And it is through repetitive exercises about 3 times a day. They take like 2-3 minutes at a time. And I mean, they're kind of simple, but they get harder. People really realize, oh, this is like a workout. um, but with little ones, we do make it fun. We do try to make it fun, where we're making silly noises with our tongues that they think they're being goofy and making sounds, but what
Hmm.
they're really doing is, contracting the tongue muscles. And just like if you lift weights for your bicep, as that gets toned, it gets kind of smaller, in appearance, in a way. And that's the same thing for the tongue. So we're making it toned, the group of muscles, helping and teaching it where to go. And that is where a lot of times parents do see better sleep quality, better behavior, if their sleep was creating behavioral components. Eating is better. They're breathing through their nose during nap time in the car seat. They see those changes because we are teaching the body what to do with what we're born with, That's not instinctive. But back to the exercises. They're fun, they're easy, they're quick. And with little ones, we get creative. We have pom-poms and feathers and bubbles, and sometimes exercises just aren't a hit. And we move on to the next one. We keep it lively and fun. Sorry. But yeah, so that is exercise, but fun. And I hope that answered your question.
No, I did. And how many times a week and for how long? I mean, obviously I know it varies, but just kind of to put this in perspective for parents. Are we talking 1 to 2 visits a week at least normally, plus all the outside exercises for months, years? I mean, what does this look like?
Yeah, so it is about every 3 weeks. I like to see families once every 3 weeks. And that is with the mindset that life happens, but that gives them 3 weeks to really establish a routine with the new set of exercises. There will be hit and misses where suddenly the day went by and you're like, man, we didn't do it. So every 3 weeks, and it's generally about 8 to 12 sessions total. So we want families to learn, make these changes. We want to make new neurological pathways so that this is the new normal. We want to make new muscle memory, because no one wants to do tongue exercises the rest of their life. I totally get it. But it is with that mindset of let's change it. And then that way there's these new habits and behaviors that will carry them lifelong. And sometimes with little ones, we pause, we recognize, okay, we've done what we can do at their age. We use other tools like a Munchie, other behavioral components, and we let them grow for about 6 months or 8 months and kind of pick back up. It varies. Everyone is so different, but it is something that we don't want to drag on, because then the effectiveness of it is just not there, because it gets dull and boring and drug out. So we do try to keep it concise and at a reasonable pace.
And do you find, especially with kids, do you typically work more with dentists or ENTs or pediatrician? How are parents getting to you?
Yeah, so a lot of it is dental and orthodontics, but also like body work practitioners, chiropractors, kind of anyone that needs help with breathing. It kind of comes from all over. But with kiddos, it is the dental side where they're great dentists, and I think Airway is being taught more in that realm, thankfully. So they're kind of the first line of defense in spotting something, and usually it is through tongue ties that a lot of people do come forward saying, hey, I think you need this. But even more and more now through counseling avenues, the breath component for anxiety and stuff is arising.
I hadn't thought about that. I was thinking, more for, you had mentioned snoring, and that's something that we talk a lot about. I didn't think about the anxiety side of it.
Yeah. The way we breathe either triggers our rest and digest or fight and flight. And kind of a funny side story, I got my master's in breathing, and during grad school, I developed panic attacks because I wasn't breathing. So it's like when I'm learning about breathing. But then I just learned, okay, this is a stressful season for me, learned breathing tools, and I haven't had one since. So the breath really is powerful. And I think we take it for granted until there is a child or someone any age where it's off balance. It's not at the baseline. It's not where one might want it. But it is powerful either for or against us. So we want to harvest that for good.
Well, yeah, obviously. All right. So a lot of what I do is talk to guests about, what to do if you suspect your child has an airway issue. But I want to switch that up just a little bit with you if you're open to this. So curious about what are some of the tips and guidance you can provide to parents that will help them support children that, they're already dealing with airway issues. They're already there. They don't suspect it. They know it. They're here.
Yeah. I think number one, it is coming to the fact that stuff takes time. I think that's the hardest thing about the breath, because you breathe all day long, and
Right.
say until a family realized there was an airway issue, that breath pattern was so established. And now going through a modification or a change, however it may be for that child, sometimes the body's like, whoa, what are you doing? Even though things are getting better with the airway size or space or structures, shifting the breath can be daunting and kind of nerve-wracking to the body, just because it's something new. Even though it's something good, something new. So I think really creating that space to have that transition period and the patience is huge. Just because sometimes people go, well, I'm more anxious now. Like, this isn't working. I'm just going to give up. But it is that recalibrating phase. So that's a big thing, I think, just with any change in life.
Sure.
Giving that grace. And I think talking about the breath is powerful, really bringing the mind to it, also as parents, but as kids. Like asking the kiddo, hey, where is your breath today? If your breath was a color, what would it be? If it was an emotion right now, what emotion would it be? Or you have them draw what they're feeling with their breath. And I think the more kids realize the breath isn't just something that happens without thought, they really characterize it. They really create it as a friend in a way in their mind. That just gives them all the more ownership and power of the breath. And yeah, I think just really acknowledging the air is a big one, and asking, do you like nose breathing or do you like mouth breathing, and why do you like that more than the other? And that awareness thing is just huge in that those steps moving forward, I think, to get better breathing behaviors. And also one kind of little boost of confidence I would give to, even though there may be, like, sometimes people feel very overwhelmed of like, oh, my child is mouth breathing and they are emotional, and which is stressful. Like it's overwhelming and it's daunting. I think really kind of stepping back when looking at the breath and realizing, okay, they had to breathe that way for a reason. And that's not wrong. But now we're going to move forward and make just different choices, different breathing behaviors. And sometimes there will be days where mouth breathing happens, or you hear snoring, but you didn't the day before. Why is it happening now? If steps are being taken to help that, it's a roller coaster, and healing or progress isn't linear. So those up and downs will happen. But I always say every relaxing breath you can take is a deposit into your wellness. And so just the more deposits you can make, the withdrawals that happen with life, when stressed, when sick, when just having one of those days, won't be as detrimental. So any effort, any progress, any attempt at helping the airway and breath really does matter. And I think it's hard for parents when they're so up close and they're in it, they don't get a break. They would do anything for their child, and this isn't going as fast as they want, or this is happening. I think just really patting themselves on the back and saying, I'm helping them. I'm helping their airway. It takes time, but we're doing something. I think it's scary when people go through life not choosing to acknowledge the airway and its impact on our health, but can't fault someone not knowing the reason why. But I think parents, just kudos to parents who are just taking steps, even if they feel like baby steps, they're steps.
Right.
Steps
Every
forward.
step is a right direction. Right. And one of the things that I think is really interesting about having you on here, having read your website, but getting to talk to you now, is you really do put an emphasis on the mental impact that goes with this. And not a lot of people talk about that. We do talk about in signs and symptoms, when you're looking for a child with an airway issue, as you go down the list, at some point, ADHD comes up, or behavioral issues. So we understand that, right? What we don't talk a lot about is the languishing impact that having a breathing issue, having an airway dysfunction, having an airway disease, this whole group over here, the long-term mental impacts of that, or the impact of having it not only just on the child, but as the parent. As a parent, you feel like, oh my gosh, I've let my child get here. Right? And so now they have this lingering thing over them that they're having to deal with. And, for me, one as a parent, but also as a person with an airway issue, I appreciate the fact that, you really are putting this out there, that there is a mental component to not what not being able to breathe can do to your body, but you can't breathe, something's wrong. You may not really understand it, but you're different. You know there's a problem. You're struggling in some form or fashion.
Yes. Yeah. And I sadly, like, a lot of that, I think, for me, comes from personal experience. I have a chronic illness, and it is something that is highly overlooked and misdiagnosed. And it took about 17 years to figure out what it was. And so through that, I was a teenager, and my parents were those parents going, what is wrong with my child? Like, we are doing everything we can.
Mm-hmm.
And I knew I was different right away. 13 years old, I was out of my norm I lost friends. School was harder. I had to quit my sport. So experiencing that, it wasn't an airway driven thing, but just experiencing that and knowing how people looked at me as an issue. Doctors looked at me and said, what are you doing wrong? You're just stressed. They blamed my parents, even though my parents, they would take it from me if they could.
Right.
They did everything. Growing up that way and seeing how sadly some professionals looked at me, they didn't look at me as a human. They didn't look at me with layers, with emotions, with dreams, with goals, with thoughts, with hobbies. That hurt. That was a bummer. And through that, I feel like if we can give hope to one family and see them as a human, where what is talked about at their dinner table after a really hard appointment, they got hard news. What is discussed at the dinner table, and what do they want to do with their life, and hobbies and goals, and we're all humans with so many layers. And so it is just me coming alongside these families. They're the heroes of their story and of their journey. And if we can just bring joy, I mean, really, that's where the name comes from. Bring joy, even if it's in a sliver of hope, to these kids, to these parents, so that, even just a little glimmer really keeps people going forward. Because there are those moments where it's like, oh my goodness, this is so hard. And for me, I can't speak for anyone else, but for my chronic illness, it's a lot of physical pain constantly. The emotional side is the hardest for me. So even just having someone look at me and my family and say, I see you, I hear you, like what you're going through, you're a warrior. Like, how can we just continue to grow? And the more you know, the more you grow. And so that's what I want to be for others. What I didn't have through professionals, what my parents didn't have, seeking help for me. That's really where that's driven from. Just being what I hope there's more of nowadays, but there wasn't for me and my family.
Yeah, I love that. And now I truly understand the joyful breathing.
Yeah.
I love that. New parents, they're coming to the realization, okay, my child does have some kind of breathing issue. Whether they're a mouth breather, they're a chronic snorer, they're starting to see the signs. What do you recommend? What are the first steps?
That could go so many ways. When working with a newborn or a baby of any age, I love to have a broad team of course, their ped doctor and lactation, and body work. On my side, it is just teaching the little one what to do with the tongue. Really, it is through parent assists. The parents really assist and do intraoral teaching. And it is just teaching that little one how to breathe, to bring the tongue up. Because whether it's from a tongue tie, not having good latching, again, it's not instinctive for that tongue to go up and for the lips to come together. So it's really having that team to really address all angles, because not everything is perfect for everyone. But for me, it is just right from the start, teaching the kiddo how to use the mouth, because they're exploring the mouth, they're exploring the tongue, and things are going in the mouth and stuff like that. So it's very, at times, preventative. Some people come to me and they're like, hey, my oldest had this. How can we kind of rewind for this one? And
because you do see it in families, right?
Yes. Yeah. So it's structural. There are genetic components with ties, if tie was a part of it. But then also you can learn breathing behaviors from people you're around.
Right.
Kind of how you hold your stress and how you breathe and how you react. So sometimes it is preventative with little ones. But sometimes it is, how can we get that structure from the beginning to be as optimal as possible with the behaviors and with breathing, because sleep apnea can happen really at any age.
At any age.
Any age, yeah. So, and oh, sorry, go ahead.
Oh, no, go ahead.
I don't really think I had anything. I was just, I could talk about this topic forever, but it is, yeah, just seeing those signs and really thinking, okay, is the tongue low, and even mouth breathing for babies is not normal. Well, it's normal, but not it's normal in the sense it happens a lot,
but it's not normal.
It's not cute. It's not ideal. It's not good.
Right. That's a cultural change we have to put in place.
Yes. And oh yeah, that's my husband. He snores. That's normal. I was warned about this before marriage. I'm like, no.
Yeah, that's not normal.
Okay.
Nope. So I'm going to put you on the spot for just a second. And because in doing some research and things and talking to some of our parents on our Facebook group, a lot of conversation around sippy cups. So, and I'm watching your face. So
trying to think through it.
Right. A lot of what we're seeing and the questions that keep coming up, and quite honestly, I'm not sure, how do you answer this? Are you supposed to go from ideally breastfeeding, right? We know that's ideal. That's what we want. That's going to, help the jaw and the tongue, and from that straight to a regular cup. Or, if we do what culture has taught us, we go from breastfeeding to a sippy cup to a regular cup. Is the sippy cup damaging?
The sippy cup is not ideal, if I answer it in a textbook manner. Because if I'm thinking correctly, the sippy cups have like a spout out, correct? Yeah.
Right.
So what is tricky about that, much like a pacifier or a thumb, like if you're sucking your thumb, it keeps the tongue low. So the sippy cup comes in, that spout goes, of course, into the mouth, and the tongue is below it. So then that when they swallow, they're not getting that full tongue palate contact with their swallow. And that is crucial. So sometimes with sippy cups, you'll see more kind of choking or gagging, just kind of, something went down the wrong pipe kind of thing. I think like when in public, if you're going on to the zoo and you don't want to have a mess or something.
Right.
Okay. Time and place, I think, life happens. But I think overall we do want to teach the open cup, that skill really early on, because then it does require that tongue to go up more, which that'll help the palate develop. It'll help the tongue be strong and stretch what we can. And then it'll teach the proper swallowing wave in a way we want as much of that tongue to be up. If the tongue doesn't go all the way up, that's really where it is teaching like tongue thrusting with swallowing, other dental and orthodontic implications down the road. So ideally, no, we don't want sippy cups. But yeah, time and place. If you're going to someone's house and they're like totally neat and tidy and you don't want to make a mess, okay. But
sippy cup of that kid. Yeah.
Yeah, but majority of the time we do want the open cup.
Okay. Thank you. I appreciate that.
Yeah.
And then when you say tongue all the way up, are we talking all the way back, like to the back of the jaw?
We want as much as we can. Wow. And for a lot of people, maybe they're trying this right now as they're listening or whatnot. Right. You may feel like your tongue is like clogging the back of your throat. And that's really a muscle tone component. So it's acknowledging, okay, how can we make that tongue a little more uniformed? And with swallowing, we do not start that right away. That takes several sessions. So I usually start that like session 6 because there's just so many steps before that to get to in regards to the strength and endurance and awareness and coordination.
Got it. At the end of every episode, I like to open the floor to our guests. Just anything you would like to share with parents, anything you would like to guide them on, or just something to leave them with as far as, this journey they're on with their kids.
Yeah, I think I alluded to it earlier, just those steps being taken forward is huge. And parents, your child, your child best, and that gut instinct in you matters. Definitely give voice to that if you have a gut feeling or whatnot. And it's good to ask questions. We really have to be our own advocates, and there are awesome people that will join you on your team. And there are people that may have different views. But definitely ask the questions, do the research, be the advocate. You are the voice for your child. And you're doing a great job. I think just researching, sitting down after a long day of work and feeding your family and sitting down and researching at the end of the day. I mean, that's amazing. And everyone should be commended for that. And again, every ounce of a good breath that you can help your child with matters. It really does matter. And there's that saying of it takes just that 1 degree to boil water. Every breath adds up. And so keep at it. It's a long road, I'm sure. And but you're doing great, and it's worth it. From the breath comes everything else. So this is probably the most powerful thing you can do for your family and your child and yourself.
Awesome. Thank you. Joyful breathing. I appreciate everything that you've shared with us today. Thank you so much for being here.
Thank you. It was wonderful. I really appreciate it as well.
Thank you.